I think one of the fears that patients have related to surgery are the fear of loss of sexual function and urinary incontinence. And these really have changed over the last decade. Surgical techniques have improved, and we tell patients that their risk of severe urinary incontinence is very, very low.
The big hope, or the great hope, of minimally invasive surgery and robotic prostatectomy in general is that we might be able to improve our outcomes in terms of providing a greater chance of complete urinary control and also a much higher chance potentially of recovery of erectile function.
In terms of potency, if a man is completely potent before surgery, this is typical of perhaps a 50-year-old male who has no pre-existing medical problems such as vascular disease, diabetes, heart disease, and they're not using Viagra, that man has an excellent chance of having spontaneous erections after surgery when we utilize a nerve-sparing technique.
And one of the first questions they ask, well, what about your love life? What about your sex life? What does it do? And I'll tell them in a minute, I said, well, you're going to have some problems. Things not going to work out as well in the beginning. But that's where you have to sit down with your spouse, and there has to be this understanding that things are going to work out, but it's going to take some time. And it does take some time. But with the Viagra that's across the counter now, that you can buy through prescription, with the papaverine, the shots that you can use, or there's a pump that you can use, all those things are very effective and they work. So there are going to be some problems. I am probably 95% now. So there may be another 5%, and the 5% may be because I'm 53 rather than 35 or 40 now. But I don't have problems anymore. Everything's back to normal as far as I can tell, and everything functions well.